Well, good evening, good evening, good evening. Thank you all for tuning in. We are apologizing for just coming on a little bit late. So many things are happening, technical difficulties, but Dr. Afflalo, we are so happy to have you here today. So, as you said, ask Dr. Afflalo. So, Dr. Afflalo, take it away.
All right. Thank you, Dr. T. So, good afternoon, everyone. Or evening, actually. Just want to let you know that we have a special guest today. Um, as you know, September, we're acknowledging the fact that it's Ovarian and Prostate Cancer Awareness Month. And so I have a special guest today that has actually gone through a journey of not only fighting prostate cancer, but also breast cancer. So I want to introduce Mr. I was going to say Cecil, Mr. Russell Stepp, which is Cecil Stepp's son. And I just want him to actually just share his story about, what he's had. Tell us a little bit about basically what kind of work you did that actually put you at risk for your cancers.
Well, first off, I'd like to thank you both for allowing me the opportunity to come in. Dr. Afflalo, I have amazing mad love for you because all the things that you've done for our community, you've always just kind of put yourself out there and tried to make sure that we could all learn and that we could grow and that we can be better. So it's truly a blessing to come before you and just have this opportunity to be here with you both today.
Thank you.
Yeah, I was been in San Diego my whole life. I ended up getting blessed with the opportunity to be a firefighter for the city of San Diego. And man, what an amazing opportunity that turned out to be. One of the side effects, though, was getting exposed to different kind of chemicals. The clothing that we wear, we're finding out that firefighters' clothing has chemicals on it that can cause cancer. Of course, going into fires, you're always exposed to cancer-causing things. Back in the day, our badge of courage was walking around with dirty clothes from being in the fire. That was like our thing that said, hey, we're actually out here doing it. And we later found out that stuff is really not good for us. And eventually they brought in washing machines, and we got a chance to kind of change that. But moving beyond that, after I retired, I found out that I had carpal tunnel. So it was, I believe, in January of 2021, I had carpal tunnel surgery in January. I'm sitting on the couch, ice in my chest, ice in my hand, and I put my hand on my chest and I feel a lump. And I tell my wife, hey, wow, I got a lump. What do you think? She said, you go to the doctor. So I go to the doctor. I have Kaiser, and my doctor said, get a mammogram. So they sent me to La Mesa, and I had an opportunity to get a mammogram. And it was really interesting to walk into a place where mostly women are. And as I walked in, I could just see the look on the women's faces. And being a man of God, I wanted to say something to them, but the Spirit said, no, don't say anything, just sit here. And so I sat and I just watched. I had an opportunity to get the mammogram. And right after that, they told me they had to get a biopsy.
Yes.
And so I went into a different room, and they laid me out on the table, and man, what an amazing experience that was. That was like, whew, very painful.
Yeah.
And whenever I talk to a woman that has gone through breast cancer, and we talk about that moment, we can connect right away because, man, what a transforming experience that was. But to lay on that table and they take the punch, and they took the 5 plugs out of my chest, and wow, that was something else. But moving along, after they took the plugs, then I got a call. I never forget. It was February 26th, 2021. My grandkids are walking into the house. My son is dropping them off. We're going to watch them for the weekend, and I get the phone call. The lady from Kaiser calls and says, Mr. Stepp, I'm calling to let you know that you have tested positive for breast cancer. And when she said that, I smiled. I actually laughed. I never forget my wife listening to the conversation because I had it on speaker. I kind of heard her just kind of have a sob for a minute. and my son was walking in, so he's listening to the conversation too. And as I'm speaking to the lady and just kind of lifting her up, because I can only imagine what it must be like to call people
To give the bad news.
and give them that news all the day. So I tried to lift her up. When I talk to people about that day and that call, they wonder why I laughed. And the reason I laughed is because as people of God, when we walk by faith, we don't always understand what's going to happen to us. But we know that God has us. And so no matter what's going on, I laughed because I said, wow, God, you're going to bless me with the opportunity to do this. I'm going to grow, and I'm going to be able to bless some other people in the process. And that's really kind of what happened from having that experience.
Wow. Wow, that's pretty amazing. So it sounds like from the time that you felt it and the time for the biopsy, and then we'll talk about treatment after, was pretty short.
It really
Yeah.
was. It
They were
really
able to
was.
get you in, get the mammogram, get the biopsy, and then tell you the news. And then next steps are talking to a surgeon and or what are your treatment options, but depending on the staging of it. You know, was it a, you know, stage whatever, and was it a DCIS? Was it, you know, was it aggressive? So tell us a little bit more about what the biopsy said, and then your surgeon, what they said in terms of how to treat that cancer.
So when I spoke with the surgeon, they told me that I had HER2 negative
Yes.
breast cancer. And so, you know, as I got a chance to do the research, I understood that, you know, it's the proteins, and that the negative allowed the opportunity for me to go with a specific treatment option. And the surgeon suggested that double mastectomy. And so, you know, I was like, okay. And I took what he said, and had an opportunity to talk with my dad, talk with my wife, and just talk to another friend that was in the medical business. And they said, yeah, it's probably the best thing to do.
Yeah.
And so one of the cool things is I got a chance to get a referral to the Firefighters Cancer Support Network. One of our chiefs, she had an opportunity to go through breast cancer, and she was able to kind of direct me into that organization. And in the process, I ended up talking with another firefighter who was actually a renal firefighter, male, who had just a single mastectomy. And, you know, when I talked to him and I got a chance to understand what he went through, and I really had a peace about myself because I understood that he didn't experience a lot of pain with it. And, you know, that he was able to move forward with his life. And I think sometimes when we're going through something, we don't want to tell other people.
Right.
And that's kind of one of the worst things you can do.
Right.
Because a lot of times when you open your mouth and you share what's going on with yourself with other people, then you actually provide an opportunity for God to send that person or somebody else who's gone through that to come alongside of you and help you. And so what you do for the community is so, so important. The exams, the health cares, times just the testing, and trying to make sure that we're as well as possible. That's really important. So
Yeah.
I have to lift you up and commend you for reaching out to us and
Thank
trying to
you.
make us a better community. So
Yeah, absolutely. And that is my God assignment, you know,
Yeah,
is
yeah.
educating the community so that they can, when they feel a lump, go and get it evaluated. I know that process, even though you knew that God placed this on you, you know He doesn't give you more than you can bear. You had the support around you
oh,
to
absolutely.
get you through the process. And like you said, you reach out to your chief who had breast cancer as a female, but you also reached out to another person in the organization that had breast cancer. So it sounds like when the surgeon recommended bilateral mastectomy, which men do have breast tissue, but not as developed as women, that taking out all the breast tissue was going to give you a better fighting chance. Because the HER2 negative means that the hormonal treatment's not going to respond. You're not going to get the same response as if you had something else with a positive estrogen receptor or something. So you give a medication and it would treat it.
Right.
HER2 negative is one of the ones that black women get, and it's hard to treat. Tends to be aggressive and hard to treat. So probably the right thing to do was to take out as much breast tissue as possible and to give yourself a fighting chance of having full recovery and remission. Did you have to do radiation or chemotherapy or any hormonal therapy afterwards?
The hormonal therapy is tamoxifen.
Yes.
And so I'll be doing that for 5 years plus. Yes, I did chemo and radiation.
Okay.
Man, those two things were really kind of interesting. In the process, I had some negative things that happened. I got a MRSA infection on one side. I had a chest.
And MRSA means methicillin-resistant Staph aureus. So staph bacteria lives on our skin, and normally we get a cut and staph is there. It doesn't give us a bad infection, but the MSRA, the MRSA, it basically is resistant to normal antibiotics, and so it can be aggressive. And so I had to do some massive treatment on you to try to get rid of that aggressive staph infection.
Absolutely. I rolled in one day. I was going to have chemo that day, but I had a slight fever, and the nurse didn't want to do chemo. But I was telling them that I had some leaking in my chest and was trying to get help. Sometimes in the medical profession, you have to be loud. Sometimes you have to stand up for yourself. You have to speak up for yourself and do whatever you have to do to make sure that you're going to get the medical treatment that you need. And sometimes us as people of color, sometimes we have to go to a place that we don't necessarily want
Yeah.
to.
Well, they
But
don't listen to us.
Yeah, they don't. They don't.
They minimize our concerns, our complaints, and then if you're not careful, like you said, if you don't become a real good advocate for yourself, then you will end up dying or having massive infections because they didn't listen to you the first time, the second time, or the third time when you said, hey, I'm having some leakage. That's not
Absolutely.
normal.
Absolutely.
So I'm glad you did step up and push the envelope so that you could get the treatment and still be here to talk to us today.
Absolutely. And I'm grateful for the people that are around and are supportive. A lot of times we have friends and family people that are telling us, hey, go to the doctor. Hey, go get it checked out. And a lot of times we wait and we wait and we wait and we miss our opportunity. So when we're there and we have an opportunity to get the help that we need to make sure that we push.
Right.
And if we're not going, we need to step up and make
Yeah.
sure we.
And I think,
go.
and a lot of people have a good reason to not go. They're afraid of the
Understandable.
doctors. They're
Understandable.
afraid of the experiences, the negative experiences they have, the disrespect, and the disregard. And so our people tend not to want to go in because they're anticipating that that's going to happen. But all we have to do is find the right person that's going to be a true advocate on behalf of our medical conditions and want to help us get better. So if you run into someone that you feel is not on your side, a provider of any sort, your medical provider, physician, nurse practitioner, PA, that you just need to find someone that's going to listen to you and really take heed and want you to do well. And not all of them are out there. So not all providers are equal.
That's true.
Yeah.
That's true. I talked to a friend and he said what his mom used to do is she'd go and sit in the office and wait and make them take care of her.
Yeah.
And so, I've tried some things along that line, and you know what? Sometimes that really can make a difference. And so,
Yeah.
but usually having a good relationship with the person that's providing your health care makes all the difference
Yeah.
in the world.
If you feel comfortable with them and you trust their judgment, then yes, then you will want to move forward, especially if it looks like they're being honest and truthful about what it is, transparent about your conditions and the options, giving you good options, and letting you know so that you can make the final decision. But being there by your side to make sure that you have the options to make that good decision and then walk forward with it. So it sounds like you've had some good support, not only from family and friends, but you had a provider that at least provided you information to be able to, like you said, go ahead and move forward with the bilateral mastectomy. And so obviously it is aggressive because you had all the breast tissue removed, you had chemo and radiation.
Yeah, that radiation was something else.
Burned your skin up, didn't it?
Yeah, it burned it up.
Yeah.
I remember coming out of the radiation, and my wife would be like, "Whoa,
Yeah.
you smell like barbecue, son. Smell like you've been at a fire." And
Yeah.
it was something else. But man, throughout the whole process, just being able to love up on the people that I was exposed to. Sometimes when you're in the chemo area, you see people who are really going through it.
Mm-hmm.
And sometimes that's when God allows the opportunity for your faith to be a crutch to help somebody else.
Absolutely.
And so, man, in the chemo chair, I've had the opportunity to talk with all different kind of
To
people.
minister to them. Huh?
Yeah, for real.
Yeah.
In the midst of my storm,
Yeah,
you
yeah.
know what I mean?
Yeah.
But He gives us that umbrella so that we're going through the storm. He knows He has us,
Mm-hmm.
and we have the ability to share that with other people. Same thing in the radiation waiting room.
Mm-hmm.
Man, just saying hi and just talking to people
Mm-hmm.
and being positive made all the difference
Yeah.
in the world.
And sometimes it pulls them out of their whole woe is me,
Yeah,
to realize that there is, it's a half full versus a half empty thing, that there's still an opportunity to have life and good life. We just have to go through the storm right now of the treatments. And the treatments are miserable.
Yeah.
The chemos, did you have a lot of side effects with your chemo?
the first part of the chemo, they gave me the red stuff. I can't remember. They called it the red something. I
Red
don't-
Kool-Aid juice? No, I'm
yeah,
just kidding.
yeah, it wasn't Kool-Aid. But, man, that stuff was so strong that
Mhm.
it came to the point where I just wouldn't eat before I would
Mm.
go and have that. And that was like my first 4 sessions. And, man, that was really a trip. But I got to give it to my wife because every day I got out of that chemo chair,
Mhm.
our thing was we'd go and walk 3-4 miles. And
Okay.
so we'd get out of the chair,
Mhm.
go in the car, and we'd go for a walk.
Go for a walk.
Yeah,
Okay.
and
Kind
so-
of try to keep your
Yeah.
life in some
Yeah.
form of normalcy.
Just push,
Yeah.
I'm going to push through
Push
this.
through
I'm
it.
going to push through it
Yeah.
and just push. And man, it's something pretty awesome to have somebody to go through that with you and
Yeah,
just kind of
someone's in your
help
corner.
you as you're going through the process. So,
Absolutely.
yeah.
So, if you remember, which one was first, the chemo and then the radiation, or the radiation and then the chemo?
It was the chemo first, followed by the radiation last. Yeah.
And how many weeks or months of chemo do you remember?
I think the
having?
chemo went from June through September.
Okay.
And then October, I picked up radiation and went through Christmas,
Okay.
on
through
the other side of
holidays.
Christmas through January.
So like a 3 months and maybe another 3
Yeah.
months or something like that. Okay.
And so what I found is that was a prescription for what I was going through.
Mhm.
And a lot of people ask, well, do you still have? And I believe I've been cured.
Yeah.
I believe I've gone through the prescription that was
Mhm.
prescribed for what I had.
Mhm.
And, I continue to move forward.
So do they, as follow-up, because we're making the assumption that the chemo killed every cell in your body that was unhealthy and probably some healthy cells too, radiation burnt off your chest, any possible few cells that might have been running around that were not captured from the surgery were killed with the radiation. I'm assuming they gave you some, statistics as to the longevity in terms of that, but what is your follow-up? Do they do a PET scan on you once a year or something to make sure nothing's rearing its ugly head?
Absolutely not.
Okay.
And that was kind of interesting. When I talked to my oncologist, he was saying that, no, the new thought is
Mhm.
that if something else presents itself,
Mhm.
then I contact him
Mhm.
or my doctor, and from there they'll go and do an assessment.
Mhm.
But as they believe that sometimes the scans for breast cancer, a lot of times they'll find an artifact and stuff
Yeah.
that they're not sure
And
what
they'll
it
be
is.
chasing down
And
something
exactly,
they don't need to.
and
Yeah.
so they kind of want to hold on to that, and I could kind of understand that from their
Mhm.
perspective. It's spending a lot of money too,
Right, right.
looking for something that might not
Might not
be
be there.
there. Yeah.
And if you had taken the unilateral mastectomy, then you'd have to do a mammogram every year and all that stuff. So you'd have a different type of workup. And then the tamoxifen for 5 years. Back in the day, they used to do 10. So
Right.
now plus you've had everything plus 5. So after that, you stop that and then you just wait and see. But, the assumption is you've done everything possible. So you should be in full remission.
Absolutely.
Yeah. Okay. So then the journey jumps from breast cancer to prostate cancer. How soon after your breast cancer that journey did you find out you had prostate cancer? And was it from just a routine PSA level that you identified it, or some urinary type symptoms?
You know what? In between the breast cancer and the prostate cancer, I ended up going with lymphedema. When they took the lymph nodes out of my arm swelled up,
Mhm.
lymphedema.
Mhm.
I had a physical therapist with Kaiser, and she really stood up for me
Mm-hmm.
and really kind of pushed and got me some help that I truly, truly needed.
Mm-hmm.
I have compression garments that I wear for the lymphedema, but my hand swole so bad that they suggested that I try a lymph node transplant, and so that was kind of a cutting edge there.
Mm-hmm. At the time.
Yeah,
Mhm.
and so they took lymph nodes out of my neck, placed it in my wrist. Unfortunately, that surgery didn't
Didn't
win.
take.
Yeah, it didn't take. So about a month later, my wife said, "Your hands, your arm smells. Go to the doctor." So I went to the doctor, and they looked at it and saw that it had
The graft had failed.
yeah,
Mm-hmm.
and so they took that out, and I continued to move forward in the process. You said the transition from breast cancer to prostate cancer. It was kind of interesting because we were on our way to Monterey, and I had my PSAs were really slow.
Mm-hmm.
For the fellas, PSA is one of the tests they do, blood test, and they can kind of get an idea of the proteins that are going on in your body. When I looked at my graph in 2015, my PSA was 2.1,
Mm-hmm.
which is kind of low. So the average guy, you want to be between 2 and 3, is usually thought to be kind of okay. But then I got a spike in 2020. It went to 3.5, and then in 2023 it went to 9.7. And so they saw a slight rise over the years, and that's one of the cool things I like about the medical care I have. They'll give you a chart and kind of give you an idea of where you are, what's going on, and so you can kind of keep an eye on it, and they're keeping an eye on it for you too. But when that spike went up, I was like, whoa. And so I had to go to the urologist, and when I went to the urologist, they said they had to do a biopsy again, and so, man,
That's not fun.
that biopsy is no joke. But you know what? A couple of minutes of discomfort is priceless, because I have a lot of friends who have relatives and a lot of black males that have died as a result
absolutely.
of prostate cancer.
Absolutely.
And so, you know, being proactive really, really makes a big difference. And so I would suggest that my brothers would go out there and get checked.
Yeah.
One, get your PSA checked. It's a really simple test, and they can let you know rather quickly. And if you keep an eye on your numbers, then you have an understanding of what's going on.
Absolutely. And we're recommending, before the average age was 50, and then you'd almost have to fight your provider to get it. Now the recommendation, especially for African American males, because it's so prevalent and is strong in families, that they're recommending at the age of 40 to start ordering the PSA levels, 40 to like 59, because it's just prevalent. And if you have a family history, if you need to be more vigilant.
Absolutely.
Yeah, like and there's several types of prostate. I mean, there's all kinds of Gleason scores, but if you have a family history, you really have to stay vigilant about testing. But there's cancers that are super aggressive and some that don't grow that fast, and so you can either die with it, which means you die from something else and you had prostate cancer,
Right.
or you can die from it.
Right.
So my father had prostate cancer. He ended up dying from a heart attack. He had his procedure and all that stuff done. He was on Lupron, and so his prostate cancer was under control. He ended up dying years later from a heart attack. But my brother was younger, and he had prostate cancer. He had to be more aggressive, Gleason score 9 or 10, and had to be aggressive about it. So you have to keep an eye on it, and you have to, do what's necessary. There's all kinds of options. So you can tell us about the option you had, but, they have all kinds of different treatments on prostate cancer depending on how early you have it, how early you capture it and identify it, and your Gleason scores and what the recommendations are by your urologist and your oncologist. But you don't want to die from prostate cancer. If you catch it early and do something about it, you can certainly live a full life.
Absolutely. And so my message to the brothers is make sure you get tested. And it's really pretty simple. When they did the biopsy, they said I had a Gleason score of 7,
Okay.
3, and a 4.
Okay.
And so what they do is when they do the biopsy, they take the tissue and they look at it under a microscope, and they figure out what type of cancer it is, and from there they give you a score, 1 through 5, for each portion of the test they do. And when they put those two numbers together, that kind of gives you an idea of what your Gleason score is. So mine was relatively low, 6 to 7. They said is in the low. 7, 8 to 9 is moderate, and then 10 above is more aggressive stuff. And man, I have an opportunity through one of the organizations. I'll talk about it later. Is they have a Black men's prostate group that gets together 2 times a month, and I'll drop some information on that as we get down the road a little bit. And they really help make a big difference.
Okay.
You talked about the different options I had once I found out that it was prostate. I have numerous friends who have gone through surgery. My father had an opportunity to go through surgery. It's changed a lot from what it was when he went through to what it is now. But from talking with the fellas that have gone through surgery and talking to another urologist, I also spoke with some of the gentlemen who had radiation. One of them is a 90-something-year-old, and he had it 40 years ago, and he's still moving and grooving and still. So when I looked at the effects, radiation, if you choose to go with radiation, it kind of makes it so they can't do any surgeries down
Exactly.
there. So once you go radiation,
That's it.
you kind of signed your certificate that, I'm going to stop whatever's going on there, but there's side effects that are associated with radiation. But when I compared what my brothers were going through that had the surgery versus the ones that had the radiation, I chose I chose the radiation. I have a friend who went with the radiation seeds, but to me that didn't make sense to just have something just sitting in there and
Working on the cells?
yeah,
Whenever it wanted to?
working on, just sitting in there. And
Right.
I thought I've had enough stuff. And so having gone through the radiation, it was a trip right back to the same place down in Chula Vista. Had an opportunity to love up on the people in the waiting room again, and here I am getting barbecued again. But
And that's a very delicate area, so
Yeah, it is.
it's hard to wipe and do all kinds of things if your skin is burned.
It is. But they were really kind of gentle in the amount of radiation and the way they did it.
Okay.
It was completely different from
And more targeted
It was
than
more
just
targeted.
the whole chest
Yes,
area for the
exactly.
breast. Yeah.
So if I show you my chest, you can see a
Big old burn thing.
big old dark thing.
Yeah.
But in McGroin, the way they were doing it, more targeted,
More
like
targeted.
you said.
Okay.
So and less burning. So
Okay.
I think the intensity was decreased, but
The longevity. So you have to
Yeah.
go longer, but you
Yeah, a
have
little bit
less,
longer.
less rads at each visit.
Exactly,
Okay.
exactly. So, man, it was a trip going through that radiation too, but I'm glad I chose the way I chose. And like I was saying earlier, one of the things that was kind of helpful was talking to other brothers. And Zero Prostate Cancer Organization, they have a special group that's set up specifically for Black men. And like I said, they get together every
Couple weeks?
second Monday and the
Okay.
fourth Monday of each month, and it's virtual. And man, you see how hard it is on men, Black men, to have this part of your life altered.
Altered.
And
yeah.
so to have the place where they can come together, where we can come together and say what you're going on, speak with other brothers who have gone through things, trying different techniques, is really pretty helpful. And so you see the brothers who are just getting in and coming in, sometimes in tears, but having that iron sharpen iron type of thing,
Exactly.
where we get a chance to help each other out is a really positive thing.
So do you, for this support group, do you normally get people that are newly diagnosed and getting ready to do treatment, so you can tell them the 2 and 3 different types of ways that they might consider, or there is more after they've gone through it, and the support of just kind of dealing dealing with the cancer and either the current or recent treatment, and just getting back onto life now.
Actually, it's both.
All
And,
of
and
them.
the cool part is for the brothers who are just getting diagnosed,
Mhm.
just starting in the process, they have a group of brothers that can talk to them, kick them game, help them to understand.
Mhm.
Hey, check this out. Try this. Go
Mhm.
this way.
Mhm.
This worked for me. That didn't work so well.
Mhm.
You know, just so they can
Yeah.
have a discussion and understand surgery versus radiation.
Mhm.
Well, how do I do that? What type
Mhm.
of radiation? You know, and so for the ones that don't need either one of those things, there's also the pharmaceutical things that they can use
Mhm.
that can help them out if they're not such an aggressive prostate things.
Right. And I'll just say, because I'm not sure how comfortable or uncomfortable you are with it, but obviously there's all kinds of risk and drawbacks to having surgery, because where the prostate is, to have a prostatectomy and remove your prostate is by a lot of delicate tissue with nerves and things, the nerves that supply the penis. So a lot of times the surgeon, the urologist and the surgeon will tell you that if you have surgery, you may become impotent.
Absolutely.
And or have bladder problems.
Absolutely.
Because those are the nerves that feed your bladder, and all of the stuff. So that's something to weigh into the decision, especially if you're younger, fairly newly married, you still have a very sexual, life, and that really can put a damper on you, become depressed and things like that. So, but it's all about life or some other way of figuring out how to, be in relationship with your partner.
Absolutely.
And so, and they are, there's implants and things like that, there's pumps, but those are the decisions they have to think through when they decide to do surgery versus radiation. And then there's also side effects to radiation too.
Absolutely.
So
Absolutely.
those are the things that the guys really need to talk to the other men who've gone through it and say, hey, 5 of us over here, we've had sexual dysfunction because, unfortunately, it's really hard to not cut the nerve.
Absolutely.
To
Absolutely.
then have an erection. So that's what they have to deal with. And how do you guys deal with that?
That's the big decision.
Yes.
And that's one of the reasons why I chose to go with radiation as
Mhm.
opposed to the other one. Because when I was talking with the oncologist,
Mm-hmm.
he was saying, excuse me, with the urologist, he was saying it's basically cutting the wires.
Yeah.
And I've talked with some guys who've talked about the wires are slowly growing back
Regenerating.
and
Mhm.
regenerating, and they have the ability to move forward
Mhm, mhm.
and have an erection or
Mhm.
to
To
let
be
the,
intimate with their partner in a different way.
or to let the diapers go,
Yeah,
or
yeah.
all of the things that's associated with the surgery part.
Yes.
And
It's a major adjustment to life.
it is.
But depending on how aggressive it is, you might have to take the aggressive route. And so those are the things, if they have all that information, then they can make the best educated decision for them.
Absolutely.
So surgery's not the right thing for everyone. Maybe radiation is, or whatever it is. There's various other options, but they have to get all the information so they can make the best decision and be able to live with that decision.
For themselves.
Exactly. With the
because
possible consequences that
absolutely.
come with it.
Absolutely.
So that's a tough one.
It is. And so just having the opportunity to come and speak with you today and putting it out there for
Mhm.
other people, other brothers to kind of get the word out, it's really important. We're here in San Diego. If there's a lot of brothers who have gone through this, I know that they'd be willing to step up and help. If there's somebody who's going through something like that, or if you're getting to the place where you have to make that decision, we can come together and just set up a little discussion group here in San Diego where we can bring brothers from different sides of the equation, and you can just kind of, we can put you up on game to help you.
Yeah. Let them pick your brain and decide,
Absolutely.
so that they can
Absolutely.
say, oh, you know what, I didn't think about that, didn't know about that, I didn't realize that this was an option. So really being able to have that conversation in a trusting way, because you're talking to brothers,
Absolutely.
and the room should be safe,
Absolutely.
and they're not going to chat your business because your business is the same business they're dealing with.
Exactly. And you know what? But the thing about it is sometimes keeping the business quiet
Yeah.
affects and hurts everybody.
Yeah.
Because then you don't get a chance to get the healing out.
Yeah.
And sometimes just speaking on something, there's amazing power.
Yeah.
You know what I mean? Shame the devil, and he got to bounce.
Yeah,
You know what I mean?
and there's nothing to be embarrassed because you didn't bring it on yourself. You just happen to have some cells that mutated that then, manifested in your prostate, and you now have prostate cancer. So you don't have to feel guilty about anything. You just have to get on with diagnosing it early, screening, because you can't prevent it.
Right.
If you have a prostate, you're at risk for prostate cancer, period.
Absolutely. Period.
So
Yeah.
you just have to follow and check. And if there was a pill to prevent it from happening, prevention, we would do that. But
Absolutely.
there's no prevention, but there is cure once it's diagnosed early. So early prevention saves lives.
Absolutely.
And then that's why you diagnose it early. And so if you're following your PSA every year or a little more often, if it starts creeping, in the 0.2s and 0.5s up from 2 to 3 to 4, because there's different ranges for different age groups. As you get
Absolutely.
older, it's going to be a 3 to 4. A little younger, it's a 2 to 3 or a 3 to 4. So your age determines the range of your PSA level. But once you start getting out of that normal and you're creeping up, by a 0.2, 0.5, they should watch that, and at some point they need to get in there and biopsy. And it's not fun, but if you get the diagnosis early, you can treat it aggressively
Absolutely.
and really still have full life.
And
yes, it changes a little bit.
Live with it.
Yeah, exactly.
You can live with
Exactly.
it. Exactly. And
Yeah.
so, there's a lot of brothers who didn't know and didn't go, and they didn't
And didn't make it.
it. Absolutely. So, I choose life and
Yeah.
life abundantly,
Absolutely. So, and it's a blessing that not everyone is comfortable sharing their story either, but for the ones that, that are willing to help the next brother out, because suppose you didn't have anyone to speak to, then you would be going through that struggles on your own, not
Absolutely.
knowing what decision to make or whatever. But the more we share with each other, the more people feel comfortable going forward, and then the more you owe it to the next set of people that are coming along the way. Hey, it's not that bad. Here's what you need to do. I'm on the other side of it. You can see there's still life after the diagnosis. So cancer is no longer a death sentence.
Absolutely.
It's just a process you have to go through.
It is.
And like you said, you had a family history of it. So all that family member is at higher risk for it, and everybody should be checking earlier. Your sons at some point need to be checking. If they're not 40 yet, they should be checking very soon.
Absolutely.
Yeah.
But in addition to a family thing, you also have to think about environmental
Yes.
things. And so a lot of times the jobs that we have, we get exposed to a lot of different things. I think about my brothers and sisters in the military. They're being exposed to all different kind of things. A lot of these jobs, there's chemicals that we're getting exposed to. So you have to be proactive and make sure that you're watching out for yourself.
Absolutely.
We watch out for our finances. We watch out for our health. We watch out for our families. We watch out for our favorite teams. We watch out for a lot of things. But one of the most important things we can do is kind of monitor where we are. And the more knowledge we have, the better we're able to do. You spoke about the recommendation is that young men get it at 40. As a black man, I would go 35. I'd go earlier.
They make it a fight, but they can insist. So in other
Absolutely.
words, especially family history, the recommendation used to be 50, then they moved it down to 45, 40, especially for African-American males, because they understand the increase in prevalence. But you can certainly, if you're concerned, and especially if the father had it maybe at a slightly younger age, they should really push for it. It's not any sweat off their back. It's a simple blood test. It don't cost
Absolutely.
them anything.
Absolutely.
So they should definitely
and
get
they're
it.
already taking blood
Exactly.
anyway. So
Just add a PSA to that list of
exactly. Just a
blood
simple
tests.
check,
Yes.
extra check box,
Yeah.
and maybe another vial, and that's not really a big thing when it comes to it.
Right.
So
Yeah.
checking sooner. Another thing I'd suggest for the brothers is the colonoscopy, making sure they get that colonoscopy sooner. And one of the things I found out, sometimes if you have a doctor that might not necessarily care to have you do that right away, if you tell them you have tarry blood or
yeah.
blood
Tell 'em what they
staining
need to hear.
in their
Yeah.
stool,
Black stool.
yeah, tell them you have a black stool, and man,
They'll jump on it.
They'll jump on it and
Yeah.
want to give you that test, and that way you can start down that process also earlier, just to make sure that the inside stuff you can't see is doing right. So that
Yeah.
would be one of my suggestions.
Yeah, colonoscopies are definitely important, and we usually that was once again a colonoscopy at 50. That's now gone down in age 2, and if you have a family history, that's even earlier. My brother died at 39 of colon cancer. It was diagnosed at 35. We don't even screen at 35.
Exactly.
So he never had a chance to get screened, but he did have probably symptoms that he should have gone to the doctor for. So when you get blood in your stool at 35, especially over 40, that needs a colonoscopy without a doubt. So you do need to. They can't just poo-poo it and say it's hemorrhoids. No. it might be further up. So
Exactly.
they definitely need to make sure that
Exactly.
they're screening. And then, yeah, if they don't see anything, no polyps, they can go every 10 years. They can do the FIT test, which is now more specific. It's not just blood in your stool. It's more specific. The blood in there is not just, it's going to identify whether or not it's cancer type stuff. Or if, that it's not false positive. But the colonoscopy is a visual test. Does your entire large intestines.
Absolutely.
From the sigmoid, transverse, ascending, transverse, descending colon, all the way over to your appendix, to look on the lining and make sure there isn't any polyps. That needs to be biopsied. So, because a polyp is a polyp, but it may have some precancerous cells that they need to watch.
And if they do the biopsy and they get that spot, then
Yeah.
they can let you know exactly what time it is.
Exactly. And if it's not, if they're benign, if they're just polyps, adenomatous polyps, then they just watch it closer, 3 to 5 years instead of a 10-year. But if you have no polyps, you can go a 10-year, because those things tend to grow slowly. But the minute you have a polyp, you're talking about a 3 to 5 year follow-up. Because if you get more polyps, they'll take those off. But if you get more polyps, there's always a risk of that turning into cancer cells.
Exactly.
Yeah.
And so be proactive
Yeah.
instead of reactive.
Yeah. And don't let them tell you no.
Absolutely.
Yeah, because they have a tendency to, it's like the money's coming out of their pocket to give you a colonoscopy. I mean, Cedric Bozeman died at 43-ish or something, 39, 43.
Yeah.
But he apparently had some symptoms, and I think he was going to the doctor, but I don't know how much, all the money in the world, if they still ignore you, they ignore you.
And if you find out too late, then,
Yes.
then
Yeah. So if you're having black stools or something, or bloody stools, and you don't say anything, you just say, oh, it's probably my hemorrhoids, and you minimize it, then of course by the time you go in there, it's further gone than anticipated, and then it's harder to get that horse back in the barn.
absolutely.
If you're at stage 3 and stage 4 and it's already spread to other organs, going in there and taking out a piece of the colon doesn't help, because the cells are everywhere else.
It's already gone.
Yeah.
Yeah.
So we really want to catch it in a stage 1, stage 2, when it's localized to the tissue wherever it is, and get treatment on that.
Absolutely.
So, yeah. So so you've shared your journey, and you're pretty unique. I think you're the first male that I've met that had both prostate and breast cancer. I've had some males that have had breast cancer, so it's not impossible.
Yeah.
It's just not common.
Yeah, they say
like
1%.
women.
So
Yeah.
yeah.
So it means, I tell people, as long as you have breast cancer, you're at risk for having breast cancer. So anytime you have an organ, you have risk for that mutating and creating cancer. So don't minimize finding a lump on your chest area as a male, because you can have breast cancer, and you want to catch that early and be aggressive with it.
I believe I felt it earlier,
Mm-hmm.
and I just,
Wasn't sure what it was.
yeah, I
Yeah.
think I even had a doctor push on it or something. They were like,
Mhm.
man,
Yeah.
I don't know. But as it continued to get a little bigger, then yeah, that was kind of the thing.
So you think it might have been
So-
there a few months?
I think it could have been there a few months earlier.
Okay.
Yeah, absolutely,
Okay.
absolutely, for sure, maybe 6 months plus.
Okay.
But man, it's just going and having that opinion, or just going and getting it checked out, made all the difference in the world.
Yeah.
I'm grateful for my wife saying, "Hey, go to the doctor."
Yeah. They always say the wives nag us. And nag
No,
us.
you
Here's
know
my
what?
note from
You know
here's
what?
my note from my wife. She made me come in, but she wants you around.
She put me up on game, and I'm grateful I listened.
Yeah,
You know
yeah.
what I mean? And immediately I went and handled it. And my doctor is a woman too, and she told me, "Hey, continue it down the road." And so I'm
Exactly.
truly blessed to listen. You know what I mean?
Well, you're more rare, because I do have a lot of patients that don't listen, especially males. Sometimes it's pride, sometimes it's fear, sometimes it's like, I got this. They think they know more than whatever, or they deny that they can even get it. Like, it's not going to happen to me.
Right,
You know how we are as a people.
Absolutely.
Until it does.
Yeah, until it does.
We tell them about their blood pressure being 180 over 100. It's like, I'm really concerned about you. You could have a stroke or a heart attack. Oh, I'm good. I'm like, could you come and get your blood pressure? Oh, my blood pressure was good yesterday. What was it? 160 over 100. No, that's not good. And plus, that's yesterday.
Yeah,
So my question to
absolutely.
you is, why don't you want to get your blood pressure checked today? Because I'm going to tell you that it's high, and you don't want to do something about it. So you're walking around playing Russian roulette with your life, because one of these days you're going to have a stroke or a heart attack, and I don't want to have to tell you I told you so.
Real talk, because tomorrow I have an appointment with a blood pressure person.
Yes.
And we're going to go through it, and she's going to put me up on game and figure
Yeah,
out.
check your
Ex-
meds, see what's going
exactly.
on, make sure you're in, because you don't want that now that you fought 2 good battles to just go down with a blood pressure thing that's so easy to manage.
Exactly.
So
Exactly.
y'all
adjust
out
my
there,
diet, whatever I got
yeah,
to do.
don't ignore it. It is important to know your numbers.
It is.
And there's a reason why. I know as Kaiser, when I was there 25 years, you have Kaiser, that we'll nag the heck out of you. We'll call
Absolutely.
you and say, you need to get this, you need to get that, you need to keep coming, your mammogram, your this, your colonoscopy, because they practice preventative medicine.
Absolutely.
We don't want to be chasing the horse out of
And want to
after
spend all the
something.
money. Let's keep it.
Yeah,
let's
yeah.
keep you cheaper.
Let's keep you healthy,
Exactly.
so that we can continue to, expand or whatever.
And you know what? I appreciate that because we all need that leaning.
Yeah.
We all need that little push. And
Yeah,
So,
yeah. How we doing over there, young man? We just kind of left you out of the out of the conference. Do you have a question for the young man? I see stuff on the thing, but I can't see that far. Any questions for us?
Well, that's okay. We're going to blow it up for you so that you can
Okay.
see just a little bit more.
I just see a wow over there.
Yeah, there are a lot of questions. I think that for most men, the fear is losing their sexual
Mhm.
connection with their mate. How did you all handle that piece?
you know what? And that's one of the reasons why I chose radiation because it still afforded the opportunity. And speaking with the young man who was 90 plus, he said that, yeah, I was able to have a candid conversation.
Mm-hmm.
He's like, yep, I can still do it.
Mhm.
That wasn't a problem. And so that's why I leaned that way.
Mhm.
And after talking with the people who had the surgeries, like I said, the side effect is once you have the once you have the radiation,
that's
they
It's
can't,
one and done.
yeah, they can't go in and do any
They can't
surgery
do
after
the
that.
tissues are too friable. You've already fried them up. You cannot go in there and cut.
It's like taking
Yeah.
barbecue and trying to turn it back into regular clean meat again.
Yeah.
It's not happening. So.
Yeah.
So you said they can't go back in and cut. So
They
what does
can't.
that mean?
So if he happened to have a recurrence of the prostate, they did the radiation, but if for some reason there's recurrence in that area, they can't go and do a prostatectomy. So your choice, you make a final choice there.
Right.
If you do a prostatectomy, of course the risks are much higher for being impotent, and having urinary incontinence. But if for some reason you have recurrence, you can go back in there and have radiation at that point or something else.
Exactly.
Yeah.
So in my case, then they'd have to go with something pharmaceutical.
Mm-hmm.
Okay.
So drugs to
Yeah, like a
try to-
chemo or something.
Yeah, exactly.
Okay. So let's talk about the relationship. You talk a lot about your wife. Let's talk about the tough times. How did you make it through the tough times when you began to doubt?
You know what? We walk by faith and not by sight,
Mhm.
and that's where the trusting in God is the strongest thing. And I don't know if it's from the job I went through, from the way I was raised, but just sometimes in life we go through the storms of life, and there's when we get an opportunity to really meet God, really
Mhm.
spend time with Jesus, really grow our faith. That's how God grows us. You know what I mean?
Mhm.
It's the stuff that hurts us, that pushes us towards Him, or
Mhm.
helps us go towards Him. And you know what? From the prior storms, I just had a level of faith, so that I honestly laughed when they told me it was coming,
Mhm.
because I was like, "Thank you, God, that you trust me enough
Mhm.
to allow me to go through this thing. Thank you, God, that you allow me to go through this thing and see what other people are going through.
Mhm.
Thank you for allowing me the opportunity to go through something that women experience
Mhm.
and something that men experience, because then I have the ability to talk to 100% of the population about what you do when it gets tough. And you know what? I just thank God, and I really sincerely just leaned on God, and man, God is amazing, and I'm just grateful. I'm grateful when I get up and go to the bathroom in the
Yeah.
middle of the night. It's a
Yeah.
blessing, and sometimes we are surrounded by blessings,
Mhm.
so many blessings that we can't even see how God is watching us. I just came back from Costa Rica, and I was in the rainforest, and just looking at nature and just seeing God.
Mhm.
I saw a turtle that laid its eggs the night before, and they put a GPS thing on it. And I watched this turtle as they let him out of this box, and this turtle was grinding, just pushing through the sand, just all it had, and it would stop and catch its breath. And I could understand, I could relate to what that turtle was going through, because sometimes in our lives, we're just pushing through, and sometimes we don't know and we don't understand, but God just continues to draw us and move us forward. And as that turtle got closer to the ocean, it just stopped, take his breath, and it would continue to move. That turtle hit that water, and tears flowed down from my eyes because I saw the awesomeness of God in his creation, and understand that how awesome he's created us to be and what he's done in our bodies. I just count it all joy.
So, man of great faith, pushing forth, how did you then help your children and your grandchildren when they were seeing you going through? How did you help them be able to navigate this with you?
By letting them see, by keeping it 100 and letting them see the tubes and letting them understand exactly what's going on. We were at a family dinner, and one of the granddaughters grabbed my fan as we're praying, and she sees that the chemo had made my fingernails black. She's like, "Grandpa, your fingernails are black." But I was able to tell her, "Hey, you know what? I'm going through some stuff, and the medicine that they're giving me that's what it's doing to my fingernails." So being open and honest and sharing exactly where you are and what you're going through, and just keeping it 100.
Wow, what a testimony! And I know that your children are going to probably do a documentary series on how Papa made it over.
Hey, you know what? God is amazing. And you know what? It helped me grow in faith, but it propelled their faith. And the other people that were around watching, because everybody's watching. Everybody watches us. You're an amazing man doing amazing stuff in the community. I see you. I understand the things that you are doing and bringing to our community. I haven't necessarily spoken with you a lot. We don't really know each other, but I know what you do by the fruit that you have. And so they will know us by our fruit, you know what I mean? And the cool part about when God grows that fruit on us, other people have an opportunity to dine from that. So thank you, Dr. Afflalo. Man, you've blessed me so many ways. I was with this sister the day my mom passed, and so this is my doctor. The last time I got a chance to work with her as my doctor, man, it was a special day. So your fruit has blessed us. Your fruit is feeding the community. Likewise.
Yeah. And then just to see the fruit of your parents' labor.
Absolutely.
Brandon and his brother and all of the folks that over at David Hart, I shout them out. Cause I remember when they was just in the garage.
Absolutely.
And Shotty G had done his first project over at our facility. Just to watch how God has continued to bless the family to be in service, and so many people are tied in to what the service that was laid out. You spend, believe it or not, I followed you when you were in the fire department. And to know that you have produced so much good work, and this the stories that I believe you can share with other young men that want to go into firefighting and the opportunities that are there. And just even know that we have a black chief right now.
Absolutely.
You know,
and we watched him.
Yeah.
We helped raise him. And you know what? We're proud of him. We're proud of him.
Yeah,
and he's doing good. He's doing really good.
Yeah.
And he's the right person for the job, too. For real.
So we thank God for it. But this, the lean back for all of us that I keep hearing you saying, but for the grace of God.
But for the grace of God, absolutely.
And that's the power statement that I think that we all lean back on, is saying that you see us, but we want you to see the God that's in us, because he goes before us. He pushes the way through. And this is a God testimony. I don't believe that you can go through with this smile on your face unless you had that relationship with God.
Absolutely.
And I believe that God just whispered in your ear and said, "Don't worry about it. It's going to be all right. I'm just using this as a testimony."
Exactly.
Yeah.
Exactly.
Yeah.
Exactly. It's funny that you say that.
Yeah, absolutely. Well, I do want to, I know I have my commercial to do, but I do want to thank you, Russell. It's been an amazing journey for you, but you have gone through it with such grace. and thank you for sharing your story. You know, it's truly an amazing one. Continue to share it
Absolutely.
and with your men's group, at church, at any platform, because it's wonderful, but it also gives God the glory, which is the most important thing.
That is the truth.
Yeah,
That
so
is
I
the
want to
truth.
thank you for taking the time to come out today and share. I'll probably drag you back in here again for something else.
Anytime, anytime. I'm always open.
Yeah.
I always think that, when we start talking about mental health and everything else of that nature, this is something that I think that would be a great topic. And just the whole thing about men being open enough to talk about either insecurities or fears that we face when we go through those tough times. And so, again, I had to turn you all the way up, brother, because they said, he's so soft-spoken.
Yeah, soft-spoken.
And I was going to tease him. I said, that's part of his stilo. He'd be like, hello. So he draws you closer in.
Yeah.
So everybody, all y'all were listening real, real close so that you could hear him. But I think that you spoke loud and clear. And the times where you put things into video or put it on the air, it doesn't go out void, but it becomes a permanent part of the atmosphere. So we
Yes,
thank
yes.
you for that. You can always see this on our platforms. It's on YouTube right now. It's on Facebook right now. And it will stay permanently up on YouTube. So anytime you need to say, brother, go see my story, say go to GOD Radio, and it'll be right there.
All right, that sounds like a deal. One thing before I part, though, we got to be careful what we say. I can remember being in a fire station and joking about having cancer one day.
Oh, wow.
Joking.
Whoa.
And you got to be careful what you say because sometimes we speak stuff into being. And
Into existence.
So be wise, be wise.
Oh, I'm going to take that to heart. I try my best to keep my mouth shut at
Yeah.
all times anyway. Unless
Dr.
somebody
Fa-
asks me to speak.
Dr. Fala, I see millions in your life. I speak an overflow in your life. Brother, I speak blessings on top of blessings.
Absolutely.
As long as you just
Absolutely.
speak
The power of life
positively
and
at all
death.
times.
Yes,
It's
sir.
the power of the tongue.
In
I
the
got you.
tongue. Yes,
Yeah.
sir. That's
So I'm going
the
to do my
truth.
little commercial real quick before
Yeah.
we have to get off the air.
Well, I want you to talk about this,
That's
and
what I'm
then
talking
we'll. Okay.
This is my commercial. You can do the other commercial.
Okay. I thought you was talking about the other commercial.
You can close it out with our
Yes.
clinic, because obviously we have an amazing clinic out in Spring Valley, IWC Primary Care. I'll let you do that one. But of course, the ONS, yes, you need to share that too. So every first Wednesday of the month, we have a community health and resource fair that's held at the Jackie Robinson YMCA. We've been doing this for 8 years. The good Lord has blessed us to continue to do it and for me to still have sanity to organize it. So next month, like I mentioned, it is ovarian and prostate awareness month regarding cancer. And so this was a very timely conversation that Mr. Russell blessed us with. But at the resource fair, we have all kinds of screenings. So I do want people to come out to get your blood pressure, your blood sugar, your cholesterol, your A1C if you're diabetic. Get that screened so we can know where you are and address it. Also, UCSD's mammogram van will be there. They have a 3D mammogram van. We obviously have all kinds of other UCSD Shiley Eye Mobile Clinic for free eye exams and free glasses, HIV testing, all kinds of things out there, right? So just come out and get blessed. There's a lot of vendors, 45 or more vendors. We've actually shifted a little bit. We're not taking the entire parking lot up. We've shifted to the back of the parking lot of the YMCA, and we've put the vendors on the field so we can create some more parking for them. But and we have free produce for everyone. Last month we fed about 450 families. So we're there to just serve and to just be a blessing to the community. But most importantly, the whole reason why we started this was to identify if you have a medical condition that you're not aware of, to bring it to your attention and go and seek help. So we have consultation, medical consultation, and health there. So just come on out and check us out. Just check us out and see what we're doing. We're there every first Wednesday from 10 to 3, Jackie Robinson YMCA. And I do know that Mr. Stepp had something he wanted to share about the support group. Or you have, oh yeah.
Yes. Zero Black Men's Prostate Cancer Initiative Virtual Support Group meets 2 times a month on the 2nd and the 4th Monday of each month. The coordinator, his name is Terry Lukowski. You can reach him at Terry, Terri, at zerocancer.org. His phone number is 202-578-1933. You got to register, and then you have an opportunity. If you got something coming up, if you are just getting diagnosed, there's a great place to come and let the brothers talk to you and help you find the best way to deal with whatever you're going through.
Well, What a great show today. And I do concur that we need to have hashtag Nobel Peace Prize for Dr. Aflalo. We need to
Who
go
said
ahead
that?
and just start the hashtag.
Yes,
And let's bring it
yes,
home to San
yes.
Diego. This is our modern day Mother Teresa,
Yes,
all the things
yes.
that they say. So yeah, I think we're gonna start that hashtag, Nobel Peace Prize for Dr. Aflalo. Dr. Aflalo, we're so proud of you, and we're going to end off with your clinics as our final word. This is IWC Primary Care, and you all have a blessed day and evening. This is Ask Dr. Aflalo.
Are you seeking personalized medical services that prioritize attentive listening and addressing the underlying cause of your health issues? IWC Primary Care, part of the esteemed Sharp Community Medical Group, has opened a new clinic in Spring Valley. Our mission is to provide high-quality medical care in a compassionate and patient-centered environment. We are providers who listen and providers who care. IWC Primary Care Clinic is located in Spring Valley at 10225 Austin Drive, Suite 105, conveniently situated in the same building as Sharp Care. We accept all Sharp health plans, as well as most major insurance plans, such as Medicare Advantage and commercial plans. IWC Primary Care, a Sharp Community Medical Group clinic, owned and directed by Dr. Suzanne Afflalo. Visit our website, iwcprimarycare.com, or call to book an appointment, 858-648-0755.